Single complete denture, mandibular single complete denture versus a natural dentition, or it is either a versus a partial denture or versus existing complete combination syndrome. This syndrome is mainly related to a case when the patient has upper complete edentulous arch with the presence of lower anterior teeth only, and the premaxilla undergoes severe resorption. It is usually accompanied by development of fibrous hyperplasia of maxillary tuberosity. So this picture represents the criteria of combination syndrome: presence of lower anterior teeth, severe resorptions of the upper premaxilla, overgrowth of the or hyperplasia of the fibrous hyperplasia of the maxillary tuberosity. Combination syndrome, also called Kelly's syndrome, because of the first one who know this syndrome is Kelly's in 1972. He attributed the case of when the patients construct upper complete denture without restoring the lower posterior teeth. So there is a habitual continuous force by the lower anterior teeth on the anterior part of the maxilla, cause resorptions of the bone, and continuous pressure on this bone, the anterior premaxillary area, lead to change the bone structure into a fibrous tissue. Also, from this chart, it appeared that continuous pressure, if the complete denture constructed with the presence of lower partial denture and equalized occlusion, so the pressures once applied on the anterior part does not have an effect, because of the pressure will not concentrate only on the anterior area. But when the patients have only lower anterior teeth without restoring the upper arch by complete denture, or restoring the upper arch without making lower partial denture, so there will be a continuous pressure from the lower anterior teeth over the premaxilla, lead to its resorptions of bone, change bone to fibrous tissue, and consequently lead to hyperplasia of the maxillary tuberosity and reduced interocclusal space. And this picture show anteriorly when the patients wear a denture, upper denture, opposed by lower anterior teeth without restoring partial denture, so there will be a continuous pressure over this anterior area. This continuous pressure by the denture over this anterior area lead to the pressure from the border, formations of this fibrous hyperplasia or denture fissuratum, epulis fissuratum, lead to over fibrous growth of the anterior part of the maxilla, and overgrowth also. There will be an overgrowth of the maxillary tuberosity area with adequate retention. Next step is cutting osteotome is used to plan the bone and the tunnel, smoothing out of rough area, creating a smooth passages, and finally they place the hydroxyapatite in order to rebuild the anterior part of maxilla. And this is the picture of patients after 6 months post-operatively. The maxillary tissue will no longer loose and now has load-bearing capability. The other complications from Kelly's syndrome, also there is a possibility of fracture of upper denture, and this is because of the denture will receive excess load from the natural teeth, and there is an participating factor that can produce denture fracture, such as excessive anterior occlusal load, deep labial frenal notch, high occlusal load due to excessive actions of masseter muscle. I mean that when the patient or case has an upper complete denture opposed by lower natural dentition and continuous pressures on the anterior area with the presence of wide frenum, and this continuous pressure with time lead to the fracture of the upper complete denture from the anterior area. So what are the solve of this problem is by doing metal mesh, use of metal mesh for the strengthening of the upper complete denture in order to avoid fractures of complete denture. And this is a picture of final complete denture strength by metal mesh. For the mandibular single denture, the prognosis of mandibular single denture against the natural teeth is less favorable than when full upper denture is opposed by lower natural dentition, and it would be difficult to classify this case as a clinically successful because of either excessive resorptions of the lower ridge due to greater stress per unit area delivered to the residual ridge, and the amount of firmly attached mucosa to the denture is reduced in the lower denture in comparison to the upper. Also, the denture bearing area in the mandible is less than that in the maxilla. So that's why the prognosis of mandibular single denture is less than that of the maxillary single complete denture. So this case of lower single complete denture, mandibular single complete denture, need to alternate line of treatment plan. When this case come to clinic, patients having a lower complete denture opposed by natural dentition or opposed by partial denture, so it's best to select other type of treatment plans, such as doing an implant supported prosthesis, use of reline material in order to increase their retentions, because of the mandibular single complete denture have very poor prognosis. And thank you for your kind attentions and listening.